Okay, is it on? Okay, so calling the Senate Special Committee to order. I hate to say this is our last meeting because I did that the last time, and that wasn't our last meeting. So we'll hear from the Lieutenant Governor. Hawai'i was on the agenda. I'm not sure if they're going to be able to send a representative. Then we'll hear from a presentation from Dr. O'Carroll, and we're going to hear from the mayors as well as OTS and the Attorney General. So just why don't we start with the City and County of Honolulu real quick, because the mayor only has 10 minutes. And then we'll go to the Lieutenant Governor, because those are the only time constraints other than the Attorney General, which is only available till 2 p.m. So, Mayor Caldwell?
Chair De La Cruz and other members of the committee and everyone else on this Zoom call, I want to thank you for the time, and I do appreciate you reaching out to all the mayors of all the counties, and I appreciate you giving me the time before I had prepare this other meeting. But in a nutshell, as you may know, we submitted an order to the governor about over 2 weeks ago now, asking for 3 things. One, addressing the concern as a result of the state mandate that those coming in with a pre-test but don't have a result have a quarantine for 14 days. Be shortened now to 10 days. We offered a second test at our mobile lab at the airport. We can do 10,000 tests a day, PCR rapid test, 2 to 3 hour turnaround, and you get out of quarantine. The second request was those who have the CISA exemption being permitted to get tests when they come into Hawaii. They're coming in and out all the time, to make sure they're not positive. And the third request is for those who got no test because maybe they couldn't find a lab wherever they're coming from, or there wasn't enough time, should they show up without a test, they'd be offered a post-test at a mobile lab with a guarantee that they download an app, a tracing app, prepared for by Data House, and get a second test 4 days later, or 5 or 6. We put 4, but we're willing to work with the Department of Health at the appropriate time and get out of quarantine 14 days now, not down to 10. Our administration from day one has been about testing, as you know, working with, in the early days with Everly Well to try to get testing, building capacity at our 7 community health centers and giving them more testing, funding a lab at John A. Burns School of Medicine that is doing testing, and purchasing more tests for that lab, something like 42,000 tests. It's about testing for us, and as a way to provide that safety to open up to visitors while protecting all of us. We're still hopeful the governor will give us what we're asking for, but may not. Time is running out. People are coming in and being forced into quarantine. At any given time right now, there's about 20,000 folks on Oahu in quarantine, putting a huge burden on the Honolulu Police Department, which is tasked with enforcing. There's no way they can make 3 calls and knock on doors 3 times every day with 20,000 people in. And if we could get people out of quarantine after being safely tested, that burden is diminished. But the other thing it does, it makes it easier to enforce quarantine against those who should be. And we know from data, those communities that actually enforce quarantine get a much better result in terms of compliance and have a lower caseload. And I'm sure some of you have seen the charts of other places that have quarantine in place, like Alaska, but does not do a good job of enforcing. The number of people who complied have dropped dramatically, and the cases have gone up significantly. So we're trying to find that balance by testing and being safe, getting more people out of quarantine, and being strong on enforcement for those who are still in quarantine. And that's my presentation to the committee, and if there's anything you can do to help convince the governor and Department of Health to grant our request, we truly appreciate it. Over.
Thank you. Questions, members? Senator Kim.
Thank you, Mayor Caldwell. Can you tell me, or tell us, when you say strong on enforcement, how are they enforcing the quarantine? Because I've got reports from people and someone in my office who, because of no other reason than fell in a window, if she'd come back a day before and didn't have her tests back in time, she wouldn't have had to quarantine for 14 days, and the fact that she came back the next day, and now it can go 10 days instead of 12 days. But she said that nobody ever contacted her, nobody visited her, she reported every day. What happens to this information? How are we enforcing anything if she had not abided? What would have happened?
Well, the police department does random enforcement of quarantine now. And I've also gotten reports from guys who say, I've gotten a call from the police department, and I've also gotten a knock on a door. But obviously they can't go and knock on 20,000 doors. Impossible at this point, which is why our goal is to get more testing and less quarantine in place. They also do make calls, but obviously they're not calling 20,000 people a day, and they're not knocking on 20,000 doors a day. It's a random enforcement. They have done it, and they do catch people, and they're delivered to the prosecutor's office for prosecution.
So how many people do we have that's checking this input on the Safe Travels app? I mean, is somebody actually looking at it? Is somebody printing it out? I mean, how does the police get it? So every time they go in each day and say that they're quarantined, who's checking that information?
Well, and some of these questions you need to direct the state side.
Yeah.
Okay.
The state is acting and running the Safe Travels app.
Yeah.
We do not at the City County Form. That information is then transmitted over to the central line at the police department, and they in turn download it and send it out to various officers for enforcement. They go through it and see who's supposed to be in quarantine, and then they randomly call and randomly knock on doors for people who are supposed to be in quarantine.
Okay, so how many people are there, and maybe that's not you, maybe that's a state, but I know Lieutenant Governor's listening, is how many people actually look through, or the police look through 20,000 of these entries every day, or 20,000 in 1 week? I mean, how many people are doing that?
So I don't think that they're looking through 20,000 names every day. I think they're going through the list and selecting various names, probably.
Right, somebody has to
locations.
look to the list, though. I mean, 20,000
Right.
lists if they're selecting.
Right.
So how many
Yeah.
people do we have doing that? Or how many people in the police force are actually doing that?
The police are, my understanding, is part of their normal work day. You know, there was a special group, as you know, that were being paid for by the city and county, and that has now been stopped by Chief Ballard. So it's part of the regular shift of the different officers.
Oh, wow.
And they have the information provided to them, and then they randomly go through it and pick numbers and call or knock on doors in the areas where they are. I don't know exactly, to answer your question, how many are actually doing this at any given time, and whether they read through all 20,000 names every day, or whether they selectively go down and pick names off their many, many pages of the list to enforce on. But they are doing it in a very random way.
So some of this, I think we may have to ask HPD, but with what the mayor is saying, from what I gather, is that because there are just so many, the numbers are so high, the city and county is limited into what they can do to even enforce the quarantine, right? But I'm still concerned from our last meeting with Doug Murdoch that he didn't even have a list that he gave them. He had said, oh, the county can go on the database themselves and go look it up. So I'm not sure if that has actually been worked out where Doug actually sends them a list, or if they still have to now try to enter the database and try to see who's the new arrivals and who's not.
Yeah, well, we're just trying to determine whether or not, this thing is working, and if people are just inputting for the sake of inputting, if nobody's really looking at it, because these people, including the person in my office, is saying, what are doing this information? We have to plug it in, and
Yeah, so they're connected because there's so many people you have to follow up on. He's asking for the second test
right.
so that we can limit the amount of people in quarantine so they can actually effectively enforce.
But what number is effectively enforced? So you can't do 20,000, can you do 10? Can you do 5? Can you do 1? I mean, you know what I'm saying? What is that number? Because obviously, we're not going to be able to manage it in any large number.
But I'm not even sure the role HTA plays, because my understanding, I know the mayor said HPD is calling, but my understanding was HTA was supposed to be calling.
Calling, right.
And HTA was supposed to be hiring people to do random phone calls. So I don't know where that's at either. You know, so it's, and so now if they're out of the picture, that means the city and county has to even do what HTA was supposed to be doing. Senator Kidani?
Thank you, Mr. Mayor. So are you saying that now it's the duty of all HPD officers to follow up on complaints of quarantine breakers? And if that's true, then does that mean that you're not using CARES Act fund to pay for police time to do this?
That is correct. Your conclusion is correct, Senator
Okay.
Kidani.
And then there was also a group, Angela Keene and her 6,000 volunteers, who I thought were viable resources to let HPD know that there are quarantine breakers. Do you know if HPD is still in contact with this group, and, you know, do they take their follow-up calls?
I don't know firsthand whether they are, but I do know that if HPD is informed by whoever that someone is breaking quarantine, they will investigate and have.
Thank you.
Senator Milwaukee?
Hi, Mayor Caldwell, thank you for being here. I have a question on the, also enforcement, because you say that's so effective in other jurisdictions, but when we originally started discussing the short-term rentals, because we were looking at, without looking at the 20,000, the hotels were going to coordinate with visitors. The short-term rentals were being identified by DPP, and they were working with HTA. And I'm just wondering what happened to that, because the concern was coming from short-term rentals of not being overseen, and HPD had a hard time enforcing there. But is there some alignment of HPD with DPP and your office with DOT and the HTA, if they're still involved, on how we can close that loop, because it is enforcement if we're going to try to prevent.
But Mayor, what I'm going to ask is, if you respond to that, can you respond to that in writing at a later time? Because we really want to focus on the Safe Travels program, the Safe Travels website, and the exemption process, and part of the enforcement from the quarantine in general. So if you don't mind, if you can respond to that specific question
if you could,
at a later time.
Thank you.
Sure, we'll get a written response to you.
Okay, thank you.
So Mr. Mayor, again, in the secondary testing protocols by the counties, and it's different for the different counties, and it's kind of creating some confusion. Is there a plan to look at this statewide? Because I think also with the vaccines coming, we're also going to have to look at how do we plan to verify travelers who have received vaccinations?
Well, I think the question would probably have to be, in your conversations with the governor, how is the Safe Travels program gonna evolve with vaccinations?
I'll take a crack at it, but I do think the LG is probably more able to answer that. But the bottom line is Safe Travels program is a state-operated and managed and run program through the airports, which none of the counties have control in or over. We've weighed in on various components of the Safe Travels program from the very beginning to today, but it's not run or operated by us. And so I think directing it to the state is critical. And I think the question raised by Senator Kidani about those who get a vaccine, they shouldn't be subject to any quarantine, I would think, although maybe you gotta get two. This is a question worth answering. And I think it's something that's directed to the state of Hawaii, Department of Health, and those who run the Safe Travels program.
Okay, so before we let you go, can you just reiterate your specific request to the governor again, and just summarize it?
So our request is three-pronged. The first prong is those who don't have a result yet but got a pre-test, they are allowed to take a second test at the airport. City money pays for the test, and they get out of quarantine, so we don't have to enforce as much. Second prong, those who come in and out of Hawaii for business, which have assisted exemption, they would be tested at the airport, would be paid for by their employer because they're coming back for business. Third prong, those who get no test, but want to get out of quarantine, agree to a test that they pay for at the airport, a second test 4 days later, if they're still negative, and they download a tracing app for in-between enforcement of quarantine, they get out of quarantine. That's the three prongs, that's our request. We think they're reasonable, we hope they'll be granted.
Okay. Do you have that in writing? Do you have the request to the governor in writing that you could just send us a copy, or was that just in your meetings with the governor?
Everything we request is set in writing. We can send you the letter we sent to the governor and the order that is attached to it, implementing the three requests. And we'll get that out to you today.
Okay, I appreciate it. Okay, thank you for your time.
Thank you,
Thank
Mr.
you.
Mayor.
Okay, thank you, guys.
Okay, so let's go back to the Lieutenant Governor so he can present the Safe Travels presentation. Thank you for joining us.
Thank you, Chair. Thank you, committee, mayors. Let's see, my screen, is it up okay?
Yes.
Okay, thank you. Good to see you. I'll try to go briskly through this because you've seen or heard some of the information I'm going to give, but I'm going to update it as we go. So honored to be with you as old friends, and let's move right forward. Okay, so for the last week we have national data, week of 29th to December 5th. Hawaii was the lowest in the country for infection rate. Pretty extraordinary, even beyond just being that little yellow mark on the far side of our screen for the lowest number of cases per 100,000 people. Look at also the delta between us and Maine, which is the next best in the country. We're 50% less than them, actually less than half. So that's fairly extraordinary, and it's testament to just a lot of things. Your hard work expressing the need for masks, the community's commitment to doing that, the Safe Travels program, lots of diligence on the part of law enforcement, and nothing is perfect, but we are better than anywhere else in the country. And then if you look at the whole pandemic from March 7th to December 5th, you see that we are third lowest as far as infection rate. We would doubtless be by far the lowest, except for the months of July, August, when we saw a nasty surge. And I do think it's important to remember that was before we had any travel here at all. We had that gigantic surge because we weren't wearing masks. For the time, we had lots of large gatherings. Now, as we go through, you can see now another very important thing, the COVID death rate. For the last week, we had the lowest death rate in the country. That's obviously a reflection of having the lowest case count and the lowest hospitalization rate. We tend to see about 7 hospitalizations for every 100 cases that we diagnose, and then obviously fewer deaths when we have fewer hospitalizations. So you can see COVID is exploding in different places, particularly bad in the Dakotas, but we were lowest death rate in the US last week, and then again for the pandemic, the third lowest death rate, very close to Vermont and Maine, very rural states, but each have about 500,000 or 600,000 citizens, and they're almost entirely rural. So by any standard, Hawaii is better than virtually anyone else, which is extraordinary, but that doesn't mean we can't do better, and it's why we welcome input, constantly to try to improve these matters and why you're having the hearing, obviously. So let's go to our Safe Travels program, the pre-testing program. Since October 15th through, I have the data up through yesterday, forgive me for not adding today's data, we had 522,164 people screened, 462,949 were exempted, 13,000 were in quarantine, and it tends to be about a 2-to-1 ratio of visitors to residents. That's a little bit more than 2-to-1. But 161,017 of the people that have been screened for Safe Travels have been us. And we're very mindful of that because when people come back from their vacations or are coming back from college, what have you, they spend one heck of a lot more time with their families or back in the workforce, and therefore there's extra risk of spread just based on proximity. Let's jump over to the next slide. This is some of the safe travels data we took from Department of Health. Again, this is the pre-travel testing program numbers that we had for positive travel-related cases. This was as of November 30th. So I think Libby may have shared some of this with you, but the statewide directly travel-related cases that they were able to count was 299. And at that time, on November 30th, we had 443,660 people that were screened. City and county number 101 out of 166,107. So that math is pretty easy. That was 100. That's one out of every 1,661, essentially. Kauai County, this is their numbers and the Department of Health numbers. They had 58 positive travel-related cases as of that day. And the number of travelers from the EPS system was 53,573. Maui, 67 out of 133,000, and Hawaii County, 73 out of 82,000. So you can see that the numbers tended to be quite low, but not nothing. And we're cognizant, and we always have been, that a 72-hour pre-test cannot be perfect. Even a test afterwards cannot be perfect, but it's a question of how much balance you can strike, in our opinion. And we'll get to that balance in these coming slides. A couple more points, though, for the committee, mayors, friends. The day before Safe Travels began, October 14th, we had 105 people in the hospital. Statewide average of daily cases was 92. Our test positivity rate was 2.8%, and there you can see the numbers by county. 2.8% for Hawaii County, 3.6% for Honolulu. Kauai, at that point, had very, very low cases, 0. And then Maui County, 0.1% on the 14th. Now, on December 9th, today, we can show you where we are after these 7 weeks or so. We have 47 people in the hospital, and our 7-day hospitalization rate, I'll tell you, is 52, an average of 52 in the hospital, which is less than half of where we were before Safe Travels began. And this is the ultimate in data, because this is actual bodies that we can just count in real time, people that are sick that I care for, or others that care for in the hospital, ER, in the intensive care units, and so on. Okay. The average daily count is almost identical to October 14th. It's 94. We have a copy of that. That's going to drop actually as of probably tomorrow, because we had 2 consecutive days that are significantly lower. The statewide testing positivity rate was 1.77% as of today, and there you can see the county numbers still very low. Today we had, well, for the last several days, we had an average of 8.4 cases on Big Island, 71.9. On City and County Honolulu, average of 1 on Kauai, and 12.6 on Maui. So here's an illustration even more detailed on hospitalizations. So you can see what it looks like on the right-hand side of the cases. Cases got, terrible at the end of August and through September, and then began to decline finally through mask wearing and what have you. But we had those 105 people in the hospital, and then that dropped to 47. But look, 55% decrease. And look at the cumulative numbers of hospitalizations. So you can see right now how many people are in the hospital in each region, and then the cumulative cases. So Hawaii County, just 1 person in the hospital with COVID. Maui, 2. City and County of Honolulu have 44. And that's because Queens, which is the largest bearer of the COVID crisis, has 27 today. That's down from a high of well over 100. Hawaii Pacific Health has 7, and so on. And on Kauai, none in the hospital, 7 cumulative.
Excuse me, can you go back to the last slide?
Yes, sir. This one?
Yeah. How many of those cases are active cases?
Well, the active case today, total cases, is 1,179.
2 days or 2 days?
And that number has been declining. It was about 1,300. I can tell you exactly. Let me see that board flip one more time.
Because Kauai's numbers are low, but I guess according to what Kauai has reported, their active case number is much higher.
Yeah, it's like 20 maybe. It's been between 15 and 20. The way we calculate the active case count is the number of cases in the last 14 days, which approximates the number of cases before they get cleared by the Department of Health. So that's what we use as the surrogate. On the 14th of October, the case count active statewide was 1,267. Today it's 1,179. So that's also dropped since Safe Travels began statewide. Now the case count has gone up on Kauai, but it's up at a total of 20 cases with nobody in the hospital. I'd have to go back and look at the COP for today to get the exact number for
Okay.
you. I could.
So, and then when we met with Department of Health, they had mentioned that they don't include in their stats the positive results from the mainland. So if someone got tested in California and they came to Hawaii, and then when they arrived, they met their pre-tests, they got through, and then later on they're positive, they're an active case now, but that number is not in our stats.
It's tricky because if somebody doesn't report that they were tested, then they come down and they go straight into quarantine. If they get a call from a Department of Health that says Jack Smith had a positive test and we think he was flying to Hawaii, then they can include it. But that can create some gap. All I can tell you is what we ultimately can reflect on is the number of cases we have active in our state and the hospital number. Those are the easiest to accurately share. There's definitely going to always be some, some ambiguity. One of the reasons for having a discussion about more latitude on the test before travel is because, number one, we want our travel partners, the airlines, to help us as much as possible to not allow anybody to get on a plane if they have, a positive test. And two, it does take time to get your test result, and there was obviously a concern because people were flying without their test result and then landing and being positive.
Yeah.
And as amazing as this may sound, I really support the mayor of Honolulu's proposal to, on some occasions, test people if they're in that limbo. I also like the idea of a 96-hour window up front. I'll share that with you more in a second on a later slide. But I think, again, it gives you a little bit more clarity before people travel. And it also makes arrival testing a little bit more valuable because I think that's, well, I'll talk about that in a moment, Chair, the way I would recommend that if you're going to do extra testing. So without busting through the punchline, yeah, sure, it's definitely on occasion someone's going to fly in, but it's very few cases overall.
How do we know that if there are no stats for that? Because Department of Health had said that that's something that they're trying to track. They have information that they haven't put on their what is it, the blackboard? The dashboard. They haven't put on their dashboard yet, but they're hoping to get something on there.
Well, the dashboard numbers they gave you were those numbers I gave you back on.
No, what Dr. Kimball had said was they're starting to keep stats in other areas that are not reported yet, such as the number of active cases from other states that arrive in Hawaii.
Which will be an utterly small number because it's very difficult to travel here positive. But let me finish off those slides and then I may address some of those last points for you as we go. I won't be too long on this because I know you're going to have some time constraints and the Gov has some big announcements today, I think, too. So I was here, I wanted to talk a little bit more. So here are the current hospitalizations, like I said, utterly low. We're the only state in the country, by the way, that's seen a decrease, and we've seen a very significant decrease in hospitalizations. At the end of the day, that is your best indicator of whether a state is able to handle the COVID crisis well. And we've seen a precipitous decline, and we hope that continues because that means lives saved. The last couple slides are very relevant because they tie into what happens with or without some balance for our Safe Travels program. These numbers I won't go over all these numbers, but they're familiar to you. In March, in February, we had kind of normal travel here before COVID really was all the rage across the world, with 828,000 people traveled to Hawaii. Cut in half when we put into quarantine in mid to late March on the 23rd, I believe. April, you see we went down, it was 99.6% down to 4,000 travelers. We've had virtually no travelers until we started to uptick a little bit. We started on October 15th with the Safe Travels program. And now you can see our preliminary numbers are 247,000 travelers in the month of November without an increase in our active case count or our hospitalizations. Though we wouldn't see all of those numbers be reflected in the hospital yet because we're only 9 days into December. But it's a pretty good sign given what we've seen. We have not seen a surge of COVID statewide. And then these are critical numbers. You know them well because you know the committee that you run and the committees that we're all focused on for the future of our state. There's an indication that our unemployment claims, the initial unemployment claims, were catastrophic early on. You can see that they've been dropping, of course, and we are getting some benefits as we go forward. The economic recovery, and I'll come back, I'll share all these, of course, with you, I think, if you have them. You can see that the economic recovery has begun, though modestly, when you look at number one on the left, the economic pulse, that's essentially spending. The case counts, you can see how they drop through September, October, November, and then the passenger counts, you can see that going up now. If we take that line out just another 2 weeks, you see it going up quite a lot, which is the 272,000 number that I shared with, 247, I'm sorry, that I shared with you. And then finally, this is the slide probably that means the most to me, health and housing impacts. So this is what's actually happened to our people as a result of the COVID crisis and being in lockdown. 380,000 individuals are now on Medicaid. That's 1 in 4 of our citizens. That's 50,000 new Medicaid beneficiaries since March, 15% increase. It's a great struggle. It will also have an enormous ripple effect through our healthcare system and the survivability of the healthcare providers. But people are struggling terribly. The mental health component is not lost on us at all. In fact, it's been catastrophic for many. 43% of residents are now feeling lonely as an advanced indicator of depression. 42% pessimistic about our future, and 34% are feeling overwhelmed. Those are anxiety indicators that will translate into behavioral health diagnoses. Call volume is doubled to NAMI. The domestic violence action hotline's up 46%. We actually had one physician group, the largest physician group in the state, with hundreds of doctors. They had a 30 times increase in number of people planning self-harm, 30 times from being isolated. Food insecurity has grown by 60%. As we know, 1 in 5 people are food insecure, and UHERO broke the story on the number of households that were behind on rent and facing housing insecurity. So by no means am I saying we should open up wide. By no means am I saying we should ever close the doors to other ideas to keep ourselves safe. But also, I am trying to demonstrate with the actual numbers that the work that everyone has done has been quite successful. And unlike any other state, we've kept COVID at bay. We've been able to do a very good job preserving our healthcare capacity, keeping people alive, and actually beginning to put some economic hope into our future again as we head into 2021. And then the last thing that I would say is, as you know, by next week, we'll begin to vaccinate individuals. And in the first month, depending on how the feds come through for us and our processes, which are extremely robust, we'll start by vaccinating. We expect 12,675 doses in the first week. If everything goes right, we'll exceed 80,000 in the first month. And these are for, obviously, healthcare workers, very vulnerable elders in long-term care facilities, first responders, and so on. So once again, we'll be incrementally protected, and it'll give you guys a lot more latitude to make decisions during the session about what we do or don't have to do to protect our borders. So why don't I pause there?
Okay.
And I know you've got other people to speak today.
So if I can just ask the members' indulgence, when it comes to more lengthy questions on the vaccination distribution, Senator Ke'ohokalole and Representative Itiyama are going to have a briefing specifically on the vaccination. So if we can defer, more substantial questions to then, and then just kind of focus on the safe travels. What I did want to ask is, if you have the numbers of positive cases, I guess prior to the governor changing the protocol, that were tested on the mainland.
Okay, so I think that I will have to defer to DOH. I mean, DOH is the keeper of such records, and I'd probably have to ask you to unpack your question a little bit more specifically about which group of people we're talking about: people who got tests and never traveled, people who got tested positive upon arrival, and so on. But
no, because
break that. Well, because maybe check that for us.
Because up until recently, as long as you took the pre-test, you could get on the plane, and you could avoid the quarantine. So I guess the question is, for those who took the pre-test on the mainland, and when they arrived and they found out that they were positive, what are the stats on those?
Yes. Yes. We will track that down. That is of great interest to Libby, and we talk about that often. We think that we're going to see a constant decrease in the number of people that are willing to travel without their test, knowing that they're going to face what's now a 10-day quarantine. And needless to say, if they test positive, they got a world of problems.
Okay, so because if we don't have those stats, then I think oftentimes we're going to say that could have been community spread when that really was travel related, but we were unaware of it because of those stats.
Certainly that would contribute to an uptick in travel related, but I would postulate that almost all of the spread has been community spread by a percentage. It's been a huge majority of the spread, but not, it's not to diminish the concern that we always will have. Plus, with the explosion of COVID on the mainland, it's a legitimate concern. It's probably why, and I'll blow some of the punchlines for the Gov. I don't think he's amenable to any significant changes like as of now, the 72-hour going to 96 hours. It does not appear that he has yet approved some of the other recommendations, though I support some of them that the mayor has recommended from Oahu, because he doesn't want to take any extra risk. And though it would be great to have a test to get people out of that limbo, we don't want necessarily to encourage anyone from thinking that they can just blow off the test and travel here, because that will also create a lot of work. But let's get Libby and the Department of Health to get you those numbers, Chair.
Okay, thank you. And I just have I know members have questions, but I just have a real quick follow-up. When it comes to the surveillance testing numbers, are they reflective of the same time of when the test is taken? So for instance, in Kona, they could be at the airport when they arrive. In other cases, it's going to be several days after they arrive. What's the length of time for the surveillance test, and how consistent is it post-arrival?
It's day of arrival out to usually day 4, although Maui did some testing a little bit later, like day 6. The ones on Oahu were almost predominantly all day 4. The ones on Big Island were almost all day 1. And I know that that's been a great point of contention. I choose not to argue about that any longer. The reason being is because the more important indicators are all pointing in the exact same direction, which is COVID is contained and our policies have been sound. And they're reflected ultimately in where we can really see, which is right into the hospital where the beds are occupied or they're not. In answer to your question, though, Big Island's continuing to test, and they will continue, it appears, to test on day 1. I know there are competing proposals, although I don't see this as a competition. I'll just put this out there for you. Anybody who wants to get a lot of people tested is going to have to test on arrival. That's the only chance you have to get them. If you try to chase people down on day 4, we learned that definitely through the surveillance program, you will not get them. You will not find them. You will spend an incredible amount of energy, just like you heard the mayor of Honolulu describe the amount of energy it takes to track down the thousands of people that are in quarantine. You will not be able to achieve that. So I want to caution people about that, not because I think it's a bad idea. I think testing is very good, and that's an extra layer of safety, but it won't be achievable. And they've done a very good thing on Big Island by getting us that extra data.
Except I guess the time of incubation for COVID, it takes several days. So if you took the test prior to arrival and you land in Hilo, the incubation period could actually happen a couple days later, and so you could end up being a false negative.
Absolutely, that is possible and rare, and we would see it reflected in large increases in numbers, which we don't. After 7 weeks, we see a very low number on the Big Island. We also don't see much spread from travelers to residents. They segregate themselves out on the beaches, and there's not a lot of close contact. It is, of course, possible, and there are going to be cases of travelers who first had a negative test, then out of very bad luck, tested positive or caught it, and then were contagious enough, and then had a close contact. But if all those things have to happen, and you had a pretest, you've laid multiple layers of safety and security down. Now, it won't be perfect, and the only way to perfect it is to do what we did, and I do not recommend this, if the press is watching, is to apply the 14-day quarantine again like we did, which happened. It worked, and it meant that there were no cases virtually at all through March and April. That is correct, when we were all fully locked down. We also suffered grave injury to the economy, and we now have things under control, even with some safe travels and economic activity. So you have to balance things. That's all I'm saying.
Okay.
And yeah.
Do you have a breakdown of the surveillance tests of where they're taken? So for instance, if 5% were from Kona, or was it 50% from Kona? Do you have a breakdown?
I'll let DeWolf Miller give you that full update when he finalizes the report. Probably 90% came from Big Island, which was good. But I'll tell you though, we have hundreds of thousands of pieces of data now because of the Department of Health's data about the actual travel incidence of those cases when they came. So, and I'll tell you this, Chair, the one thing I feel badly about is that we have not spoken about masks today. If we spent this much time talking about masks as we do about testing, we wouldn't have a COVID crisis. Masks is where your answer is. It's not in pre or post testing.
Okay. Senator Kim.
Thank you, Lieutenant Governor. You said that according to the numbers, 462,949 of travelers coming in were exempt, which represents 89% of the people coming in. So when you say exempt, are you talking about business, first responders? But 89% of the people coming in that's exempt means they weren't tested, right?
No, sorry, for clarification, most of those people were tested. They achieved exemption from quarantine is what that means. So I think it's well over 80% had tests, and then I can get you some breakdowns on exactly what the exemption category breaks out as, but not to mislead, and I apologize for that. People who got exempted out of those numbers, that's the combo of people who had approved exemptions from the state, and of course the exemption, the number one exemption by a massive margin is testing negative, having a negative pretest.
Okay, so the exemption is not people that were exempt from taking the test, because I know if you apply for an exemption, you don't have to, right? You're flying in, flying out, whatever it is, you may not have to take the test or be quarantined.
Right, there are some definite exemptions. I mean, take for example, someone who has had COVID. If they had COVID 3, 4, 6 months ago, they could get an exemption if they have clearly negative status, it's been a long time, and they're immune. So there are lots of different kinds of exemptions out there, and I don't agree with all of them.
Okay, well, that'd be great to get that breakdown if we could. The other question is, with our approved partners, what is the length of time that they have said that they would be getting the tests back to people taking the tests?
Yeah, so the partners, the way that we've described this, and I'll get you the kind of the document that we now share with them, but some of them, when we had adequate capacity in the mainland, very few of them had any problems at all with the 3-day window. But the one outlier that kind of decided they just couldn't live up to the contractual standard was CVS. Now, they're still a trusted partner, but they don't feel comfortable promising that they can get it done within the 72 hours. And the average length of time for most of our partners was 2 days, 2 days to 2.2 days to get us the result back. And it's tight. I mean, that's why I would prefer 4 days, which also opens up the window. And although sometimes these individuals are a bit harsh in their criticism, that would allow for a more sensible gap in testing. So you test 4 days before and
Okay, so the person in my office returned on Tuesday the 24th, which just made it and was governed by the governor's new proclamation. Took the test the day before, got on the plane, and did not get her test result back until December 4th. 10 days. Did not get a test back. This is Walgreens drive-through on the mainland, and it took 10 days to get her negative test back. So is that what we're looking at now? And she called and they said that if it's travel-related, it's low priority. And so they get to it when they get to it, and that's what she was told when she called to check.
Yeah, there's definitely going to be some of that. It is straight up terrible. It's one of the reasons, and the one part that I like the most about Kirk's proposal is if someone is in that limbo and they test right at the airport and get a negative test, then you basically are getting your assurance. I can't support all of those proposals personally, although I appreciate that they've worked so hard on it, but that is a good way to solve that problem, because I get hundreds of texts and emails weekly that say, I'm in that bind, can you help me? And I just can't make special exemption.
Right, but Josh, if people aren't going to get their test back for 4, 8, 10 days, why even get the test? They just take the 10-day quarantine and take the chances, right? I mean, that's what's going to ultimately happen.
Well, yeah, I have a couple numbers for you already. So per your earlier question, I got the number for you. 356,511 were exempted based on travel. 34,699, for example, were airline crew. Okay, so these are the exemption types. Now, so that number of people got the negative test successfully, and we were at 94% getting it in within 3 days as of, I believe it was November 30th. But I did share with the team, just to be transparent with you, and I think this is a concern you're expressing, is having a little bit of extra time before travel to get that test result would help. We also did some analysis through Hawaii Pacific Health, and I believe HMSA contributed to this. And if you add that 4th day, it adds incrementally an average of 2.2 positive cases per day to the state of Hawaii, which is negligible. So it's a consideration, but 356,000 people successfully navigated and got their test result. But my heart is with you. I can't imagine coming here and knowing I had to go into quarantine because I missed it by a day or two.
Okay, Senator Kidani.
Thank you, Lieutenant Governor. Are we past the point or the date where the Thanksgiving spread was projected?
I think so, yes. I think that we avoided a Thanksgiving surge, it appears.
Also, are we allowing international visitors as well as visitors from United States continent?
We're beginning to, but Japan's flights are only going to start ramping up soon, and I think Canada is next. The nice thing about those countries is they are a lot stricter. They're going to make sure that everybody has their negative test in hand before travel. They have a lot more latitude. I would caution you to watch out for the Hanukkah surge. It could be lethal.
The what?
Hanukkah.
What's that?
Hanukkah is a Jewish.
Yeah.
Oh, Hanukkah.
I'm just teasing you, Senator. You're right. Thanksgiving was the scary one. Hanukkah, the Jews.
Oh, the surge, a 36 surge. No, so going to the international travelers, for the continental U.S., we have what we call trusted partners that are doing the tests.
Right.
So do we have trusted partners for international travelers too, or they just bring what they bring? We do.
No, that's a brilliant question. Actually, we do. We have, I think it's 18 trusted partners in Japan. The only challenge that we're having there, and they're going to be much more on it than we are by far, is in some of the rural areas in Japan, they are having a little bit of difficulty getting the tests. But the closer you get to Tokyo, the easier it is, and Osaka and so on. But they're really riding herd on their passengers. They're even still keeping in place the 14-day quarantine upon return to Japan because they don't trust that there isn't, a risk. And they figure that we will have some travelers mingling with, mainland travelers and so on from their country. So they do, and Canada's the same way. The airlines in Canada are partnering directly with the testing entities. So again, we expect 100% compliance with the pre-test. And another nice thing is that really helps us as far as our own processes at the airports go, because we're able to essentially pre-upload everybody's safe travels information to know that they were all negative. So they just soar through the airport is what I'm told, or how it's expected to be.
And finally, then, are all the test results in English that we can read them?
Yes, we asked for that.
Thank you.
We did. You bet.
Okay. But I don't think we get those stats, because what he said earlier was if it's, and so did Libby, if the test is taken out of state, that's not part of our stats.
Correct, but what I'm more concerned is that if they're letting them in, at least at the airport, we know that they have a negative test result and that we know it's in English so that they read it right.
Yeah. There's still a number of, but from the time you took the test to the time you land, and several days later, you could still have been exposed from that time. So that's what we're trying to get from Department of Health.
Correct, and I think that's really important too.
Okay, so why don't we go on to, did any of the other two members have questions that are on Zoom? Yeah, Senator Keohokalole.
Thank you, Chair. Thank you, Lieutenant Governor. I think you give your, can you hear me?
Yes.
Okay. I don't think you give yourself enough credit. Can you reiterate one more time the elements of the Honolulu Mayor's proposal that you do support?
Yeah, particularly the first part. So the idea of, as expressed by a couple of the previous questions, I think Senator Kim talked about, there's this limbo period a lot of people get stuck in. They've got their test in good faith within 72 hours, they don't get their result, and then they land. If you test them at the airport right there and they're negative, then you basically confirmed what you were worried about. That they, you now know that they're safe. So I like that one. The second one was from the mayor's plan is travel within the state for workers, I believe. I'm of the personal opinion that we are overemphasizing the inter-island quarantine question, with the exception of Hawai'i, which does make the right argument that there's a lot higher risk in the neighbor islands, the other islands, rather than Hawai'i. So that would be a benefit to the workforce if we're going to continue the inter-island travel rules. The third piece I don't agree with, I can tell you why, but I'm trying really hard not to be disagreeable. The idea that if people don't get any test whatsoever and then can come and test once and then 4 days later, we feel that will explode the entire Safe Travels program, because people then will definitely decide, well, I'm not even going to try on the mainland. And we want people to try to get the pre-test because it does offer.
I think I understand.
Yeah.
I think I understand. Okay, so my only other question is, we are still waiting for the numbers on the transition plan from Federal CARES Act money that expires at the end of the year into operations into 2021. When it comes to the Safe Travels plan, I believe I saw a statement from the administration that the Department of Defense would be taking over the actual operation of the program at the airport, which makes sense. Will General Hara be replacing you as the head of the Safe Travels program on January 1st? Where does the buck stop?
Probably I gave myself too much credit before, because he's always been in charge. It goes 1 to me to 2 with Libby. Libby and I are under the general. Though we often do a lot of the policy recommendations to him, but the general is in charge, and he'll remain in charge through March, I think, is the period of time right now that they've been extended. We take additional responsibility and spend more time on one part than another. Like, I've spent a lot more time on the pre-testing recommendations and the surveillance recommendations and the results, but he does a heck of a lot more than he often takes credit for, because he's very stoic in a military way and just he's not a chatterbox on TV.
Okay, thank you.
You bet.
Okay. Senator Favela?
The question that I have, I guess, not necessarily just for you, Lieutenant Governor, inter-island testing. When you go out to the app, or the Safe Travel app, they give you a list of vendors that it's not compatible with the inter-island travel. So they tell you to upload your negative result, right? Mm-hmm. And when you try to upload them, and they tell you to pick the server,
Could we not?
it shows
do that
everybody
visitors
from
can see?
Japan to Walgreens International, but they don't show the Hawaii one. And when I brought this up this morning to Ford, that's something that they said they got to work on. But I traveled early this morning to Hilo. That's where I'm at right now. I took my test on Sunday. I got my results from Straub early enough to could upload them. But it took me a day and a half to get it uploaded because they didn't have the information for the inter-island travel. And I know he said it's not in his control. It's done by counties, by the county mayors. But if we're going to be paying $175 to be clear to come on Neighbor Island, they should make it easier so us we can upload our paper, because until I landed, glad that I filled out all the rest of the information. And until I landed, I had to show my actual paper hard copy, which wasn't crowded in Hilo, so that was pretty good too, to show them that I was clear.
Yeah, you're totally right, Senator. We tried to make the inter-island travel testing simpler by approving the labs. That is now approved. So if you go to clinical labs, DLS, and the third largest lab, I can't remember its acronym, those are all going to be approved. But you're right. The process has to be perfected if we're going to put people through this. They're also finalizing the details, and I will have to defer to Director Carr about frequent travelers, the mechanism. I will say this: if we have similar rates of COVID between counties, then we are really not doing much other than pushing paper and forcing people into extra tests unnecessarily. If the rates are similar and the risk is similar, we do need to be mindful of the concerns that Kauai has had, because they have achieved, by being fairly hermetically sealed, almost zero. And I'm sure that they would bristle at any kind of recommendation about removing the inter-island quarantine and the testing for travel to Kauai, given the current policy. But I don't really know that we're benefiting anyone very much by doing this between Big Island and Oahu. The numbers are, as you saw from one of my earlier slides, the positivity rates are really dropping to a similar low number for each of the counties. And I'm hopeful that at some point in the near future, we might be able to move away from that and just be more responsible with our mask wearing up over 90%. And I'll be the first to admit, there are moments where my darn mask drops under my nose, or, it's just not 100% perfect, but we're all doing a lot better most of the time. I'm teasing you. I know, you're good. But you see what I'm saying? That's really what stops it, not the test. And so I think that it's pretty expensive and difficult for inter-island commuters right now.
Okay, does anybody have questions for the attorney? Does anybody have questions for the Attorney General, because she needs to leave soon?
Actually, Chair, I was able to reschedule, so my hard stop is 3. I defer to other members who need to go first.
Okay. Well, Senator Kidani, go ahead.
Attorney General, recently there was a case of a couple that was returning from, I believe it was Los Angeles to Kauai, and they were arrested and charged by the county with public endangering or something.
I think that's right, yes.
Yes.
Mayor
so-
Kawakami might be able to talk more to it, but yes.
Yes,
I'm aware
but
of
is
that.
it something that we could do statewide if people get on the plane knowing that they're positive and they come? I mean, I think that's a really,
That's a federal issue, right?
yeah,
Isn't that a federal
a
issue?
deterrent for them to get on the plane. But is that not something also that we could look at, statewide, United Stateswide, to ask the federal government or to assist in doing something jointly, so that we are not traveling on aircraft when we know we're positive?
I could certainly look into some of the enforcement aspects of that. I think right now what we have is there was coordination, because somehow the county of Kauai, the police department, got word of it, and they acted very quickly when they found out about it. And I think you're right, it's an important deterrent effect. I think the whole policy is to ensure that people traveling are safe for a lot of the reasons that the Lieutenant Governor just discussed. It's not just so much if those two people themselves are positive, that now affected everybody on that plane.
Correct.
So a lot of people on that plane were put on no-fly lists. They were then told they had to isolate. I don't know what other repercussions, but it's not just those two individuals. It's a magnitude of significance for other people who are affected. So that is definitely a concern, Senator, and it's reflective in some of the policies. And I think it was a good moment. Maybe Mayor Kawakami can talk a little bit more to it. And it definitely demonstrated our state's commitment to enforcement.
Yeah,
when
I
these
think
kinds
that
of
would
things
just be awesome for not just all of us here in Hawaii, but anybody who needs to get on a plane to travel for business and they have taken all the precautions and then happen to sit next to someone who could care less, you know, and that's just the way, you know, life is. And it's just a terrible price to have paid because you're taking all the precautions and then you have to be in a plane with someone who did not. So I would really appreciate if we can pursue that further. Thank you.
Well,
And I
that's,
said, Mayor, I can stay on too if you'd like to have other
Okay.
members of the panel go first.
okay, why don't we move on to Dr. O'Carroll?
Thank you, guys. Really terrific honor to be here and chatting with you all, members of the Senate COVID Committee and all the mayors. I'll just kind of go ahead and jump into sharing my screen, and that'll kind of lead into my discussion as well. For all of you who don't know me, I'm an emergency physician here locally and also a disaster response physician responding to mostly climate emergencies, most recently in the Bahamas. I grew up here, and my role, I think since the pandemic began, was I've just tried to be, like I approach my patients, just tried to be a voice of what is the latest medical science and education that I can get out, and I'll go over some of the things that I've done. So some personal history of education in this pandemic. Can everybody hear me okay?
Yeah, yeah.
Okay. Some brief history of the 1918 H1N1 pandemic and coronaviruses. A recent 12 steps paper I wrote, and some economic and public health considerations and some closing comments. I'll try and blow through this. Hopefully it takes no longer than 20 minutes. I apologize for any length. So the reason I got into speaking and writing about the pandemic was I was asked back in the end of 2018 to consult on this docu-series called by Netflix, How to Prevent a Pandemic. It came out in early January, not any conspicuous timing in any way. It just happened to be completely coincidental. Well, my role was twofold. One was to direct the production into, hey, what are plausible storylines? And then second, to talk to the who's who of pandemic response. I interviewed Dr. Fauci, Dr. Rick Bright, and hopefully someone we all get to know, Dr. David Brenner, who's invented a UV light that can kill coronaviruses and flu viruses, but also not harm us, not harm our skin or our eyes. One of the things that I found, I think, was most useful for the production team is that they were trying to film down in Southern America in our winter, and I said, hey, there's no flu down there. So it was things like that and constructing plausible ways and storylines for them to follow. From there, since I've been studying pandemics for so long, when I saw, this was March 3rd, I released an article, this one for Vice magazine, talking about, when I saw the Wuhan, the hospitals being constructed in Wuhan, I knew something sinister had been released into the population. And I'll just read the end of this. The COVID-19 pandemic will be akin to a extremely severe seasonal flu outbreak that will arrive in waves, in which young persons will be minorly affected, but will be elderly will be extremely adversely affected. And when I released that, that was back when we had a couple cruise ships on the outside of California, and we didn't want to bring those persons on to increase our numbers from less than 100 to over 100. If you can think back in that time frame, it wasn't officially called a pandemic. I got a lot of disparaging emails from even non-expert physicians saying, hey, look, you're wrong here. Think about the economy. This is just the flu. But once the outbreaks in New York and Seattle happened, most of the, if not all the emails changed to those of support. From there, and as an author, you never get to choose your your titles, and I only speak of medicine and science, and I didn't like this title, that it was so, political. But from here, I wrote an article about Dr. Rick Bright, who is now part of Biden's COVID transition team, about how he should be reinstated because he's just such a terrific mind in pandemic response. And then also, how hydroxychloroquine should not be used. And when Donald Trump did get hydroxychloroquine, or did get COVID, he did not receive hydroxychloroquine. So we knew the data was not convincing from the get-go. And so to just briefly state the objective of this presentation is to keep Hawaii afloat from both a public health and economic perspective. We must follow up-to-date scientific knowledge and research. Vaccinations are on the way, but we have to get to roughly 50 to 70% of the population vaccinated for them to really obtain any semblance of herd immunity. And I'll just point to the 1918 pandemic. It came in 3 waves. This was the early spring wave. This would be the fall-winter wave that we're currently experiencing right now. We're probably somewhere over here. And then the 1918 pandemic actually had a 3rd wave here. And hopefully vaccinations, enough of us will get vaccinated to kind of curtail the end of this, the later quarter, maybe the last third. But it's going to take a lot of work to get vaccines into a wide percent of the community. And I'd like to just introduce a concept that I like to call the COVID-19 opportunity fire. And basically every piece of wood in there is going to increase the opportunity for this virus to grow and cause the flame and the fire to get bigger. And so obviously we all know, and thankfully the public messaging has been great, that gatherings of more than 5 to 10 people are risky, especially those outside of the households. Travel is also going to increase opportunity. It's going to be another timber in there. But other things that do that are schools, which we haven't quite opened in-person learning, and our students are doing mostly distance learning. And then also, our other small businesses that have been fairly closed, bars, gyms, restaurants. Both bars and restaurants have a higher rate of communication of this virus, just simply you're in an indoor environment and your masks are being taken off. So all of these things haven't fully been enacted yet, and these are areas of the economy that I think are definitely struggling. We're seeing a lot of our small businesses shutter as well. Now, some brief history of the 7 human coronaviruses. 4 of them are responsible for about 1/3 of the common colds we get every year. Then there's the 3 what we call pathologic human coronaviruses, SARS and MERS, and then you've got this really pandemic virus and there's a couple key things about this virus that made it explode globally, and I'll go through those real quick. First is that we all know that there's a high rate of asymptomatic persons, anywhere from 20 to 40%. And you would think that these asymptomatic persons, meaning they don't have symptoms, they don't even know that they have it, you think they'd be fairly bad at transferring it to other people, but they're actually quite efficient, about 75 as efficient as somebody who is infectious or who does have symptoms. And then if you put these 2 numbers together, plus another group called pre-symptomatic transmission, where you transfer it to people before you actually have symptoms, because your viral curve, and we'll go through that in a bit, actually peaks before you start having symptoms. Roughly half of these infections are transferred before there's any hint that you even have it. And opposed to the prior 2 pathologic human coronaviruses, MERS and SARS, you could only really transfer these 2 ones when you had symptoms. And so as soon as you started putting people away, as soon as you started, they had symptoms and you started isolating them or quarantining them, the infections didn't go globally. So SARS did go quite, it did extend into Europe, but there's only 8,000 persons who were infected with SARS. So these key features at the 50% transferred before there's any hint of infection is what's caused this to go a long way, along with something called incubation period. And so we've all heard about the incubation period, and it's about, here's an illustration of the incubation period. This is
Dr. O'Carroll, if you can limit your slides to the safe travel, so the ones that's pertinent so that we can figure out what policies we should be considering in amending the safe travels.
I apologize about that. Safe travel. I will start. Okay, So, let's see where, okay, I'll start here. This is from October 19th, from the Wall Street Journal. This is Dr. Martine Citron, so that's the director of the CDC's Global Division of Migration and Quarantine. Basically, he's saying in these meetings that travelers should isolate for 5 to 7 days upon arrival, and that would give a 90% assurance that arriving passengers are COVID-free and won't further spread the coronavirus at their destinations. And I think this is really important that they're recognizing that it would one day contribute to a safe, responsible, and healthy global air travel experience, in addition to testing before and after and following public health recommendations on self-quarantine. Here's another CNN clip saying, there is no hard and fast rule, but the evidence suggests getting a test before the 3rd day after exposure is not of much use. Just because the viral curve, just like a pregnancy test, the virus has to replicate in sufficient numbers. Here's a quick clip saying that, hey, somebody tested negative 48 hours before they got on a flight, but when they got on the flight, they infected 4 other passengers and turned into a cluster of 7. This is a concept called surveillance testing, which I think has to do with what your question is, Donovan, is that the more you test, the more you're going to catch, because this viral curve increases so rapidly. We see that one test here, according to studies by Harvard researchers, that one test in 14 days, which is akin to just a one-test system, is only going to catch about 30% of people, with an additional 15% being caught by just symptom monitoring. Again, here, 40% is only going to be caught by a one-test system. And basically, I think we should compare ourselves to countries that have really successfully controlled this virus, because we know the United States has not. And so the countries that have are enjoying the economic freedoms unburdened by this virus. They've got schools going, they've got bars going, they're enjoying life. There's a lot more to life pre-pandemic that I think we've missed, and also keeping each other healthy and safe. And so all three put, the continental United States, or all these countries, Japan, Taiwan, Vietnam, Australia, Hong Kong, the list is pretty extensive, put 3 countries into the really high risk, and that includes the continental United States. And this is from an 18-chapter, really long paper called the Transparent Risk Assessment of Quarantine, where they all put them into a 14-day quarantine. No quarantine is really only reserved for countries like New Zealand, where there's no community spread. And I think this is a really important slide, which I'll also come back to, that kind of lists out exactly what, what quarantine options do and how much infection they remove. And this is person days, basically what testing or what quarantine method is going to, how many people are they going to release that are infected, and for how many days are those people going to be infected for. And so this is the standard 14-day quarantine. They didn't have 10 mentioned here. This is where we are now. It released 57 times more person days of infection than a 14-day quarantine. And a entry test like is being done on Hawai'i Island, plus a pre-test. And notice that the pre-test is not done any earlier than 3 days before travel, meaning not extended to 96 hours. There's none of those options here. That doesn't have that much of an infection decrease, and I'll get to why. I think all of you guys have seen this, but basically an entry test is useful, but it's not going to catch the people that are exposed here. If they arrive 2 days after they're exposed, it's not going to catch many people. The pre-test probability is too low if they're exposed near or on the day of travel. Now, on day 4, if they are exposed 4 days prior to travel, if you get an entry test, the false negativity rate is still really high. Even if you get one of our sensitive PCR tests, it's about a 60% false negativity rate. So an entry test is still going to miss somebody who's exposed 4 days prior to arrival, most likely. And then if we're going to look at surveillance tests, which we had some questions about before, it should at least be on day 4. And a day 4 test is going to catch a majority of people who were infected in the 3 to 4 days that were exposed prior to travel. Certainly not all of them, but most of them. Now, if we look at the the state's numbers that were released on November 20th, all of these Oahu, Maui, and Kauai numbers, as far as I can gather, these were all, as Lieutenant Governor had said before, were all done on day 4. But they, as he mentioned, it was really hard to get them there, and they have to voluntarily take that day 4 test. And there's something in statistical medicine that's called voluntary bias. And voluntary bias meaning they had to have an incentive to go. And also, they were disincentivized, I would say, is that if they did test positive, then they would be in underburdened quarantine and so forth. So if we look at those, that's actually 5 in 1,000, 3 in 1,000. On Kauai, that's 15 in 1,000. And those entry tests, as I mentioned before, there is kind of like comparing apples and oranges. And so if this was introduced into a clinical journal, I'm a clinical reviewer for the Journal of Climate and Health, you'd have to ask somebody to separate these. And so if we put all of these Oahu, Maui, and Kauai numbers together, that's something closer to 7 in 1,000. And because a test isn't perfect, it's not going to catch everybody. You could arguably say maybe this could be closer to 1 in 100. I think for those of us in the visitor industry, infection rate of visitors and returning residents, this includes everybody, is closer to 1 in 100 is something that's concerning and should be pointed out. Now, Mayor Kawakami can talk a lot more about what they're seeing on Kauai, and this is just a quick snapshot of their cases were very minimal or nominal leading up to the point, and then they up to travel, and then they have starkly gone down since travel has been decreasing. Now, important to know is that the COVID-19 total caseload you can think of as an iceberg, and the cases that are detected are only the really, really tip. And so this is case prevalence. This is also this huge group of people is people who don't have really huge amount of symptoms, but they just either couldn't get a test, they don't believe unfortunately, in getting tested. And then there's another large group, as I mentioned, of asymptomatic persons, and this is roughly 3 to 10 times as great as the actual detected case load. So we've got an overestimation of testing accuracy by at least 2% or 2 times of the one test system, and an underestimation of the true prevalence of this caseload. As I just mentioned, it roughly equates to 6 times higher than the 1 in 1,000 that we originally predicted. Now, I'd like to just go through this slide because it shows how, if somebody was exposed, they arrive on day 6, they were exposed on day 0, how a test 3 days prior to arrival could miss them because their curve hasn't really, this 72-hour test could miss them because they haven't got into that viral curve yet. We have to talk about masks because they are absolutely the most important thing we can do for decreasing transmission of cases at the moment before vaccinations come, and also the 3 Ws. But you can see here that this was a snapshot taken back in the November 16th. If all of Oahu or all of Hawaii increase their mask rate from 80 to 95%, we would have cases remain here, and this would be if we remained at 80%. Now, I just want to touch a moment on a CDC preprint that was is basically a preprint paper, a prelim research. These were all doctors, and I mentioned Dr. Citrone. He's the director of CDC quarantine, and this was talking about reducing transmission with travel by symptom monitoring, quarantine, and testing. And so I apologize, I'm going to read this, but it's really important, is that control of SARS-CoV-2 is contingent upon multiple layers of mitigation measures. Reducing the risk of transmission associated with travel is critical to reducing the impact related to importations on local health and healthcare symptoms. This is important when transmission at the destination is low, like it is on Kauai and actually all of our islands, and an introduction could spur additional outbreaks, but also when transmission is already high and health systems may be strained. And I think this last sentence is really important, is reducing risks associated with air travel could pave the way to air industry recovery, as well as offer relief to national economies and reduce social distress. And I wanted to note that they also, in this CDC paper, they talked about moving the pre-test back to 4 days prior to arrival. And they said, on the other hand, testing more than 3 days before travel provides little benefit beyond what symptom monitoring can provide, because individuals who test positive at that point contribute less to transmission risk later. And I'll show you what that looks like in visual form. So this is the day of travel, day 0. Day -6 is 6 days before travel. This yellow here is just symptom monitoring. And if you were just to monitor symptoms, make sure somebody doesn't have a fever, cough, runny nose, any symptoms at all, you're going to catch about reduced risk of transmission. You're not going to catch, but reduce transmission by about 30%. If you were to take a test at day -6 or 6 days before travel, it's the same as symptom monitoring. If you're going to take it according to this paper produced by the CDC. If you take it 5 days before travel, there isn't much difference. If you take it 4 days before travel, there isn't much difference. It's only on day 3 where you start seeing the test. Actually, this test efficacy is in blue, and then together the green is rising some. And then actually the most efficacious way that you're going to reduce transmission risk is actually if you take the test the day of travel. And what does this look like on this slide? Basically, here's this blue bar that says, hey, this is test efficacy in decreasing transmission risk. 4 days before travel, there isn't really any efficacy. It's only on day 3 that you start seeing some efficacy. Together with symptom monitoring, you're all the way up here. And if you do symptom monitoring plus a rapid test on the day of travel, you get much more efficacy here. And largely, their main conclusion was a shorter quarantine of 7 days combined with symptom monitoring and a test on day 3 to 4 of arrival is 95 to 99% effective at reducing introduction risk and less burdensome. Now, the last thing I'll go over is this resulted in the December 2nd CDC guidelines that said the safest thing to do when it comes to domestic travel is stay home. But if you do decide to travel, testing can help you do this more safely, because when you're in busy travel environments like airports, bus, and train stations, you can also spread it to family, friends, and your community after travel. Testing doesn't eliminate all risks, but it can help. Now, so if you are traveling, this is their specific recommendations. Consider getting tested 1 to 3 days, and that's why they said no shorter than 4 before your trip. Also consider getting tested with a viral test 3 to 5 days after your trip, and reduce those non-essential activities. They'll go to restaurants, they'll go to bars, essential activities only for a full 7 days. And so this doesn't say quarantine, but this is say, hey, like don't go out. And so that's where they came up with these recommendations. And then if you don't get tested, as we've heard that the Department of Health is recommending, consider reducing non-essential activities for 10 days after travel. And again, I'm just going to talk about that public health pendulum. This is gold standard. These are the 2 options that we're kind of considering. And there's a pendulum in there, and I can't finish without talking about a note on economics. So obviously, as cases go up here, our economic activities are going to go down. And again, we're in this really, really big second wave where there was the most deaths in 1918, which we're likely going to see here. And here's what the HIPAM, the travel contribution that Dr. Lee Altenberg has said. Basically, in this gold sphere, this gold line here, this was if our rate of mask use and if our rate of travel didn't increase. This is the average amount of cases, which dips all the way down into, can dip down into the blue line is the actual number. This is the orange line is the modeled number. Right here is where travel began. So if we didn't begin travel, our cases would have gone down this way, but they've actually, gone up in this direction. Now, I'm just going to come back to that COVID fire because, all I'm trying to do is present the most accurate medical science and recommendations that's out there. I'm definitely, absolutely not a policymaker, but you know, there's a lot of timber that can be thrown in to cause this fire to grow. And you know, we've got to talk about schools and other elements of the economy as well.
Okay, I just had a quick question. Can you clarify the 1 per 1,000 prediction versus the 15 per 1,000?
Clarify?
Yeah, so the Safe Travels presentation we saw earlier said that there was a 1 per 1,000 infection rate.
Sure, yeah, so I believe that if this was to be submitted to a medical journal, this would be considered in medical terms, a confounder. You know, it's like comparing apples and oranges, and you've got to separate the two. And when you separate the two, that's, you know, 7 in 1,000 rather than 1 in 1,000. And a test, as I said here, is open to voluntary bias when it's a voluntary survey. And then also it's not going to catch everyone because the test isn't perfect. So it arguably could be somewhere in the range of greater than this, anywhere from 7 in 1,000 to 10 in 1,000, which is 1 in 100.
Okay, so if we do the post-test, we're more likely to catch, I guess, the 6 additional people that may be infecting the rest of the community.
Yes, and I believe that's what's led to. Am I still sharing my screen?
No.
No? Okay. I believe that's what's led to the recent recommendations of both the Department of Health and the CDC to get a test post-arrival, because the post-arrival test is going to catch those who are exposed on travel and the several days before travel.
Okay, so that's 1 per 1,000 visitors coming in or arrivals coming in versus the 7 per 1,000.
Correct.
Okay, so right now, I guess the concern is that we're allowing at least 6 people per 1,000 throughout the community who haven't been tested that could infect others. Is that your take?
Well, not my take exactly. I'm saying that the surveillance testing has found, if you look at take the confounders out, has found that there's about 7 in 1,000 who have arrived infectious and undetected according to those numbers. And so one test is, we would have to go over, and I don't have these numbers, what the numbers of how many people were actually caught and didn't actually come here, who actually had a positive test. But when you look at the case prevalence rates in the United States, they're going up significantly, and those numbers are only going to increase. And we saw a lot of travel-related cases on Hawai'i where they can really, because they had no endemic cases, they could really differentiate what was travel-related, which started to seed community spread. And you know, when we're trying to open up the rest of our schools, our bars, the rest of our normal life, that becomes a lot of timber that increases the fire, that causes the caseloads, that will then could cause issues for the downstream issues.
Okay, so the second test would just help prevent some of that.
Correct.
Okay, Senator Kidani.
Thank you, Dr. O'Carroll. It was very, very interesting information presented. You talked about testing, whether it's the day of or 3 days before. And when you talk about testing, you're talking about swab testing and not just reading someone's temperature?
Correct. Yeah, testing is a nucleic acid amplification test or an antigen test, a swab test. Basically, either you could do a rapid one that has an 80% sensitivity, but if it's done on the day of travel, according to that recent CDC research, it's more efficacious than one day before travel, or 2 or 3. But the CDC paper was very clear that anything before 3 days was no more beneficial than just temperature or symptom monitoring.
Thank you. But when we visited the airport, I guess this has been about 6 weeks now, Hawai'i had installed thermal cameras so that they could take temperatures. that also is, I think, a preventive measure for those coming off the plane, because again, if they tested beyond that 3-day period, or did not test at all, that this was in some way a second way to do it, to catch them.
If they were symptomatic.
Yeah, if they
Yeah.
were symptomatic.
They were symptomatic, and many times people don't present with fevers. And then there is the unfortunate case of, a $5 bottle of Tylenol can, people can use those and not have a fever if they were having one before. And I'm not saying that many people would do that, but it's a possibility to thwart those symptoms of fever being caught by the screener.
Thank you.
Senator Milwaukee.
Hi. Thank you, Doctor, for the information. When you talk about you talk about surveillance tests, it's not a diagnostic test, and talking of various kinds of tests, what would be the most effective if we're trying to prevent the virus from coming in? What would we do? The pre-test, post-test, and also you talk about symptoms and monitoring that. What is the best, I guess, the best protocol to keep us safe?
Yeah, I mean, if I had my ideal system, it would be and this would never be logistically available, but 3 days, take a test 3 days before travel, and then a test on the day of travel, a rapid test at the airport. The 3 days before would be a PCR test. And then on arrival, everyone would be quarantined for a period of time that's economically viable and that's not for me to decide, or even if it's available, but some sort of period, and then a second test anywhere from days 3 to 5, and the results coming back on day 7. And now that's the complete public health standpoint, is that would be, at the moment, catch 95 to 99% of persons, but whether it's feasible from an economic standpoint is another question.
So the period of infection would be a 7-day period, so you're saying 3 days before and 4 days or so after would be sufficient in terms of that time frame?
Yeah, you're trying to catch 2 groups of people. The people who are exposed about probably 5 to 7 da's or anywhere around there before travel, and that's what the pre-travel test is going to do. And then you're trying to catch a second group of people anybody's exposed days, several days before travel, and also during travel. I think one of the highest risk things to do during travel is getting in a taxi on the way to the airport, or in the airport itself. So then that post-arrival test catches that second group of people. Now there's going to be overlap between the first and second group of people, but that's why they have a test that's no sooner than 3 days before a test. Excuse me, not anywhere longer than 96 or 72 hours before travel, and then 3 to 5 days after arrival.
And so if you had that post-test that covered this 7-day period, let's say it's 3 and 4 after, then are you saying that there's no need for the quarantine thereafter, up to the 10 days that we're saying that you need to be in quarantine if you know that on the 4th day the test proves negative, that would be sufficient?
Yeah, I couldn't say that there would be no need. The CDC recommendations say to monitor symptoms all the way till day 7. And so from a public health standpoint, to catch 95 to 99% of people, which if that's a goal of ours, you would need to quarantine until 7 days. But every day that you decrease is more chance of releasing person days of infection, which is what a lot of quarantine methods look at.
Okay, thank you.
Okay. Any questions from the other members?
Yeah,
Yeah, go ahead.
okay, sorry, I stay on my phone and at the airport, so I'm just gonna try to do the best I can. I have about 4 questions. I just wanted to ask you, you wrote an article in Civil Beat, a piece on September 4th, about the numbers increasing within a month of reopening and returning us to where we are now. When you wrote this statement, when you wrote this statement, we were at 271 cases, new cases, we reported statewide, 265 cases in the hospital. Has what you had predicted happened?
No, it has not. And I was assuming that prediction on that our tiers would have been open, and that schools would be open and we'd have bars. But I'm happy that I was proven wrong in that instance. I definitely don't want to see that. But what I mentioned is that each element of opportunity this virus has is another log in that fire, where you can get caseloads and treat once our schools open. And that did not happen, and I'm happy that it hasn't.
Thank you. Was the study you were using, and apology, making like a peer review to a standard set by scientific community, or did you have selected people and their review of this?
Oh, yeah, I think that question is referring to the 12 steps. I had 3 professors from the University of Washington review it as well. One of them was Professor Paul Pottinger. He's the chief of infectious disease, and what an infectious disease physician does is teach others how to be infectious disease physicians, any virus or bacteria that can get into the body, including COVID-19. And so he's the head at University of Washington. And so he looked at the paper and said I could put his name on it, including several other physicians at University of Washington.
Oh, sorry, yeah, bear with me because I get this mask on and the guy's talking in the background.
No worries.
Have you ever been published before in any other credible science journal? And if you did, which ones?
Yes, I have. It was all the way back in med school, and I don't remember those journals, but I can send those to you, Kurt, if you'd like. And I've also been invited to be a contributor and reviewer to the Journal of Climate and Health.
Right on, thank you. If you can send it to me, I'll appreciate it.
Of course.
Do you think we are managing the numbers well as a state? Have any of the hospitals or any of the islands fill up as you predicted?
We are managing at the moment, but that means I still think we are rolling the dice in a way. And then also there's a lot of elements to our economy and life that have not yet opened up, and we still have 4 to 6 months to go. And I do feel it's what we're doing is going thus far against international and now national scientific consensus when it comes to quarantine and testing.
Right on. Okay, this is the last one, my brother. Are you confident that the research you have done and the data you have used to come up with your theories is something we, as a state leaders, should depend on when making decisions on? Is it based mostly on actual? Where was I? Sorry, hold on, yeah. This is actually actual Hawaii data or models from other states and other countries?
All of what I listed in that paper and what I've presented are studies that not only I've used, but other physicians use, and also the CDC uses. And I think Hawaii would be wise to look at what other countries have done and what the nation's public health entity, the CDC, is recommending. Because a lot of places are recommending no travel, and that's not what I'm saying at all. I'm saying the balance needs to be looked at, that's all.
Right on. Thank you, God bless. I just want to thank you for all that. And if you can send me the information, I appreciate it. Thank you, guys. Thank you, Donovan, everybody.
Thank you.
God bless.
Any last questions before we move on to the mayors?
One question. Doctor, I have a question on most of what we're talking about on this travel is to keep the virus out and contain it in terms of quarantine and checking it out through testing. But what happens when these visitors or travelers come back in, and how do we contain it thereafter? Is there anything that you found in your research of containment as well as other than contact tracing that we can when the traveler gets through, as you say, they're asymptomatic, they get through, what do we do?
Well, I think several measures, the 3 Ws we all know, wash your hands, wear your mask, and watch who you're gathering with. But also digital contact tracing. I'm happy to hear that that's coming forth as well, because some of these transmission trains can go from a silent person to another silent person, and then the third person is the one who actually is infectious. And so you can trace those back. They do have their specific hiccups. My home, Ireland, where I was born but moved here when I was about a year old, about 25% of the population has downloaded their application. So I'm excited that, several of the Department of Health is rolling out here things on several of the islands. So I think those things, plus being mindful of, just using I think the values that we all know, aloha, kuleana, and respect for not only yourselves, but our neighborhoods and our fellow citizens is really what's has had Hawaii shine and what will continue to shine throughout this pandemic.
Thank you.
Thank you. Oh, thank you, Dr. O'Carroll. Yeah, is Mayor Roth on the line?
Yes, I am.
Thank you. If you can just go over some of your suggestions and requests to the governor on how we can improve the Safe Travels program.
Well, first, thank you very much, Senator Cruz and everybody else on the committee. I'll just say, I know Senator Favela is leaving Hilo at the airport. You could have come down. Next time you come to Hilo, please visit. One of the things that we're looking at on the Big Island is to continue our airport testing. It was looking like we're not going to be able to afford that because the CARES Act funds are running up. We are working with private partners that look like they're going to take the cost, and so we look like we will be continuing on the screening at the airport, which is a good thing. Up until this morning, we thought that we were not going to be able to do that. So we also kind of like the idea that Mayor Caldwell brought up, the first prong, where they've taken the test and tried to follow through that. We give them the opportunity to take a second test, quarantine until that test has been confirmed. Having just been inaugurated, my family, my kids came back from the mainland. 2 of my 3 kids tested negative, 1 tested positive. So as far as the Safe Travels program, we think that there is, it seems to be working. The real test that we're looking at on our island is, are we overwhelming our healthcare system? And at the current time, I believe we only have 1 person in the hospital on the Big Island, and that's in Kona, nobody in the Hilo hospital. And so as long as those numbers stay low in the hospitals, we believe that we should stay to something similar to what we have. It seems to be working for us over here. Listening to Lieutenant Governor Green's presentation, how the numbers were higher until we started testing, having that pre-test. And now they're lower. That was pretty good for us. We believe that it is working, and as long as it's working, we'll support it. But if the numbers start getting out of hand, then we'll have to reassess.
Questions for Mayor Roth? Thank you. Okay, if we can hear from Mayor Victorino. Okay, I guess
Good afternoon, everyone.
Oh, go ahead.
I'm here. I just had to get unmuted. Well, thank you, and thank you, Doctor, for your insights. And I want to thank the Senate for taking this moment to get together. I've heard a number of aspects and theories and different aspects of what needs to be done. You know, we have said fast here that the sandwich test wasn't necessary from the beginning. I've never changed our minds in that. Whether it's 3 or 4 days after arrival and a pre-test before arrival. There's no 100% fail-safe method. And, you know, I think Dr. Peng, Dr. Lacrosse, and Dr. Miller and others who are working with the state and others have all told me that there is no 100% fail-safe method. We can come up with the best science, and I thank Dr. For what he was saying, but there is nothing that we can do as far as a fail-safe method until a vaccine becomes readily available. And most of us understand that's not to be May or June. Kauai could show you infectious rates because of travel, because they had such low numbers. The rest of our counties, we had a lot more community spread and still remains high with the community spread and not as much with the visitors coming in. But we also understand that the visitors will bring some in, and like Lieutenant Governor Josh Green has stated, it would happen as time goes on. So far this month, Maui has 19 new cases. We're on a path to set a record as far as numbers are concerned. But ours is really an accumulation of what I believe was bar habit or bar behavior tendencies and bar hopping. This is one of the big things that Dr. Pang has brought forward. And also the other fact that community spread from Thanksgiving is now we're hitting the end results of what we had happen during our Thanksgiving weekend. So now we're in a mode of warning people that gatherings again for holidays with family and friends without masking, without physical distancing, can bring up large numbers. Beyond that, our hospital and our other medical areas are fairly okay as far as capacity is concerned. We want to keep the Safe Travels program working, and we'll do whatever we can. Finally, I'll address the fact that our hotels and many of our travel partners now are more willing to come to the table and help us make sure they stay open by doing what is right. A pre-test, post-test, and having areas of quarantine. We have one hotel that has given us quarantine facilities and continues to expand to help us during this period of time. Finally, again, there's no direct answer. All this scientific evidence you've shown, House is showing us something else, the medical groups there, Johns Hopkins, all these have all these different, and so it's really difficult to come to one consensus with just one study. I would say that I would like to see the House and Senate get together and start working to find a compromise so that we all can work together in harmony and not be working in different directions. The health and well-being of our residents is paramount, always has to be, and then anyone coming in, if we're not going to keep them safe and keep them healthy, they're not going to come back. Derek can elaborate more on what specific ideas HCOM has. I'd rather he do it. We've already discussed it. And I want to thank you for this opportunity to give you just a little tidbit about what's happening here in my county. Mahalo.
Thank you. Members, any questions for Mayor Victorino? Okay, thank you. Mayor Kawakami.
Thank you, Chair.
Thank you.
Thank you, committee members, for having me today. You know, our proposal, and in fact, the HCOM discussion that we had last week amongst the mayors, and we really tried to find ways to take the concerns from the industry, as well as the health and safety concerns from the different counties, and taking a look at good recommendations based on science, and also taking into account what's happening on the West Coast, where our major gateways are located at. And you know, we heard from the industry that the 72-hour turnaround time and the expectation for travelers to have the Safe Travels test result in hand was going to be a challenge. And so the discussion was to have Safe Travels as a prerequisite, 72 hours prior. If travelers have their test results, or if they don't have their test results, doesn't matter, because there would be a mandatory 4-day quarantine upon arrival, followed by a second test, of which the test should be paid for by the visitor. It's pretty much in line with what Kauai's proposal was as a pilot prior to the reopening of travel on October 15th. And we still stand firm that that is the best path forward. I will say that based on our numbers, prior to October 15th, Hawaii had a total of 61 cases. So over that long period, we had 61 cases. Upon the opening of safe travels and up until today, we've had 84 cases. So we've more than doubled our caseload. And you have to remember that we started with ground zero. So we had 0 active cases on opening day. So of the 84, 62 were travel related. 28 residents, 34 visitors, so pretty much a even split, a little more visitors than residents. 7 of those cases were travel-associated contacts. So these are positive cases that didn't travel but had close contact with somebody that did travel and became ill. And then, of course, 15 community transmission. Keep in mind that Kauai hadn't seen community transmission since July. So of the 62 travel-related cases, 38 travelers did everything right. Everything worked fine. They took their test 72 hours prior. They had their negative test results in hand. They were excited about their vacation. They boarded a plane. And for some reason or another, they came in for a second test and became positive. 18 of those travelers took their pre-travel test, couldn't get the labs to turn the test results back in time, so they boarded a plane, arrived on Kauai, test results arrived after the fact with positive test results. And at least 2 of them, as AG Connors mentioned, were informed at the airport on the mainland that they were positive but decided to travel anyway. 1 had an inconclusive pre-travel test, positive. 5 did not participate in pre-travel testing, and they were positive. So I know that we have received some criticism for perhaps overreacting. I don't think we're overreacting. I think we're looking at the numbers, and the numbers don't lie. Now, we've never said that safe travel is not working for the rest of the state. We're just saying that from our perspective, the numbers have made us rethink whether a single pre-travel test is enough. And like I said, perhaps Kauai is an anomaly, but from our numbers, it seems to be, it got us to a level of concern where we had to make the very tough decision to opt out. I would also like to inform the committee that this was always our first proposal back in October, prior to the reopening of travel, was always intended as a pilot project. We heard from the governor loud and clear that he did not want to compete with tests for our local population, and we have a team here on Kauai that agrees with that. So we went outside of the state supply chain to secure our own supply of tests with CARES Act money. We formulated partnerships to be able to administer those tests. And we also heard that they did not want to charge the visitor, which I do not agree with. I do think that visitors should pay. I think we take Hawaii cheap sometimes. But we said, okay, we hear you. So we acquired the tests. We created the partnerships to administer it. And yet we were denied, and we were given one option. You're in it or you're out, which is a horrible horrible option to give a county that so far has been relatively successful. I know that the Lieutenant Governor has characterized Kauai as being in a lockdown. I think that's a mischaracterization. We were able to open up our economy, restaurants, bars, hair salons, gyms much sooner. But not only that, keep it open and also give our residents a level of confidence that they're being protected. And so if you were to actually come to Kauai, it would almost look like it's life as normal, except for the fact that our visitor industry is still shut down. Those hospitality workers are still unemployed, but we had to make a decision. I stand by that decision, and if I'm wrong, if I'm indeed wrong, we'll accept that, and we assess the numbers every day. And if it seems to be that Safe Travels is working out with one test, we'll make adjustments. But we are on our own timeline as far as observation. I think Dr. O'Carroll said it best. What we do here on Kauai is we look out to the horizon and beyond for those tip of the icebergs. And we start steering the ship well in advance before we get close to the tip of the iceberg. As we have said before, Hawaii has many advantages. And some of the success that we've seen, we can take credit for, but a lot of it, we can't. Geographically, we're one of the only states that can effectively protect our borders from incoming arrivals from outside states. I have to tell you, when the travel industry came to a halt, about 30% of our population, which we count as those travelers, went back home to where they came from. So immediately, physical distancing started to happen because of the result of the shutdown of the visitor industry. We also have the vantage point to see what's happening across the world and on the continental United States, and be able to see what could quite possibly happen here if we don't take action. But like I said, my remarks are pertaining to Kauai. I'm not here to say that Safe Travels is not working. All I'm saying is that for Kauai's situation, we walk a fine line between health and safety, economy, and healthcare capacity. And so that's the gist of where we are at today. And if there's any questions, I'll do my best to answer those questions.
Members, any questions?
I do.
Senator Moriwaki.
Hi. Hi, Mayor Kawakami. Hi, thank you. I'm really impressed with what you've done with Kauai. I just wanted to get clarification. You're opting out because I see need for standards across the state. So you're opting out. Is it just the two tests, the pre and post test, that made you opt out, or is there any other provision from the statewide looking at it that would prevent you from having a consistent standard across the state?
Thank you, Senator. We opted out because, like I said, our numbers reflected a level of concern that required action. Our proposal was denied once, and then when we proposed it again, it wasn't turned around in what we thought was a handshake agreement of 24 hours. And we felt that due to the nature of this virus, we had to move quickly. And so we did. And it wasn't based on just not having a post-travel test. It was taking a look at the epi curve on the mainland. We also, when we're making decisions, we also take a look at the numbers on the neighbor islands and in the city and county of Honolulu, because we do realize that travelers are traveling back and forth inter-island, and a various number of other factors as well. You know, our current active cases is 12, so I wanted to accurately reflect what our current active cases are on Kauai. And as said, we have 0 hospitalizations on island because, as has happened before and on normal occurrence, the one hospitalization we had was transferred over to Oahu. So we're not only trying to protect our healthcare system, but we're very cognizant that many times when a patient gets to a level where Oahu may have more resources, that patient gets transported to Oahu and then starts, taking up bed space on your island as well. So there's a number of factors, but basically, we saw what was happening on the West Coast as red flags. California is entering into a lockdown, and it just didn't smell right when we know these folks are coming here, and we didn't feel we had a program that was robust enough to protect at least our island.
Okay, thank you.
So, Mayor Kawakami, if we can get a copy, we asked a similar request to Mayor Caldwell. If we could get a copy of your request to the governor on the changes to safe travels.
Sure thing. Chair, could I say one more thing?
Yeah, go ahead.
I know, Senator Moriwaki, I know you said, you mentioned about having some level of consistency statewide. We tried as mayors to achieve that, and I feel we're pretty close. And the uniformity we saw is that, like I said, safe travels as a prerequisite, negative test result in hand or not, you land on island, 4-day quarantine, second test, paid by the traveler. But as mayors, we also had a follow-up discussion, and it really became challenging to create that one-size-fits-all that I know that the industry and the state is seeking. We as mayors will continue to try to find some level of uniformity, but it's hard because what happens if Oahu's numbers start to surge and they start rolling back tiers, and yet the other islands are pretty darn good? Does that force all of us now back into stay-home orders or more restrictive tiers? And so I know that that's something the state and the industry is striving for, but I think we all need to realize that the reality is this is a very dynamic situation that none of us have been through, and it requires flexibility. And to assume or try to achieve or dig our heels in at times to maintain steadiness. And for travelers that are coming to Hawaii during a pandemic to expect some level of consistency when their own states and their own cities cannot even keep it consistent, I think is unreasonable. And so I would just like to say we will try, but this is a very dynamic situation we're dealing with. But we hear the state loud and clear, and we also hear our industry partners, and we'll try our very best.
I have one more question. So the consistency that I was kind of alluding to is like when Haima first started, and I think we're now looking at tiers and some standard from the Department of Health of what are the positive cases that we have that would push us into a further lockdown or not, or more lessening of the restrictions. But having that kind of standard across the board, then people can say, yeah, oh, you've got an increase in cases, so we understand where that goes. I think I was alluding to that kind of consistency more than everybody has to be the same. We're all going to lock down at the same time. And whether you had that kind of discussion, and if that is something that can be agreed to, I think people will be much more, aware of what they have to do in bringing the numbers down, for example.
Oh, that's a real big challenge. We created a tiered system too, and it looks very similar to the city and county of Honolulu's. I can tell you it depends, right? Because I mean, the 4 pillars of pandemic management 101 is that the holy grail is prevention. And I think that's what Lieutenant Governor talks about, you know, wearing masks, physical distancing, doing everything you can to prevent your community from getting sick is the number one thing. Then of course, it's detection, the ability to test and contact trace, which leads to pillar number 3, which is containment, making sure that we detect it and we quickly contain positive cases by isolating them and getting close contacts into quarantine quickly, which leads to treatment, right? That is where our healthcare system is so critical. If we have a number of sick people and we have the personnel and the resources to treat sick people, there's a good chance that those folks with underlying health conditions could make a full recovery. It's when you start seeing the healthcare systems getting pushed to the red line and doctors and nurses getting fatigued, where you start seeing tragic cases. So we created a tiered system, and we had assumed that we were going to see community spread much more prevalent than travel related, but we saw the complete opposite. And so I know that we try our best to create tiered system so that our team has good guidelines on decision making, but also to let the public know what they should expect. And it looks good on paper, but operationally it's challenging, because if you have a good team that can quickly contain a large number of cases, that shouldn't force you immediately into a lockdown. Now, if you start seeing small amount of numbers that are spread all over the island, that makes your hair raise up on the back of your neck, because those are the sprouts of what could be a mass community spread event, which makes us, that really makes us nervous when we see that sort of indicators in the community. So I know we look at numbers, but it depends on where those numbers are, where those numbers are coming from, and then how quickly we can manage those numbers and keep it low or keep it stable and start seeing a declining pattern. And look, we came out with the tiered system, and we were excited. We still stand by it as a good guide, but I think the general public has to realize that it's not the Bible of what we're gonna follow if we see that adjustments need to be made. And I know people want that certainty and that predictability, and that is something, unfortunately, I'm not able to give them as the situation unfolds.
Senator Kidani.
Thank you. Thank you, Mr. Mayor. I applaud you for what you did and what you are doing, standing your ground. I know it's not an easy task, but I think the people of Kauai know that you have their welfare at heart. I particularly applaud you for the arrest of that couple that boarded the plane knowing that they were positive. And if you were on earlier, I asked the AG if she would look into something that we could do this statewide. Actually, it should be nationwide, so that, as you talked about, the travelers coming here, we have to remember that some of these travelers have been in and out of quarantine for almost a year, since January, some of them. So they're all tired of being locked in, and they want someplace to come where they think, it's not as difficult. And so they're coming here. And with the numbers that we're seeing, it's not unlikely that we can have another outbreak like we've seen on the mainland too. So I would just like you to know that I hope you and the rest of the mayors and the governor will proceed and with the assistance of AG Connors to see if we can get some kind of law, maybe even a federal law, that would make it a crime to board a plane knowing that, or even a cruise ship, knowing that you are positive. Thank you.
Thank you, Senator. And we don't have all the nitty-gritty details, but I do know that our police department, and I gotta thank them and the National Guard, they're absolutely amazing. But what happened, to my understanding, is that at one of the airports that this couple was flying in from, had had notified this couple that they were positive and that they were not allowed to travel. And because this couple decided to travel anyway, and very fortunately, that airport personnel was able to contact our team here on Kauai, of which our officers were able to respond very quickly and appropriately. And I'd definitely like to all work together to find some sort of penalty to help deter this type of behavior, reckless behavior.
True, but think of the people that were seated near them on the aircraft, and really, I think the airlines should have taken it upon themselves to deny them a boarding.
Yeah, we think about that all the time, and you know, quite frankly, I think that is why we had been proponents of having a negative test result in hand prior to boarding an airplane, or be subjected to the mandatory 14-day quarantine, which is going to, of course, by now we all know, transition to 10 days, which we support, because we were concerned about flight crew, we were concerned about other passengers, all passengers, but particularly returning residents. But you know, certain airlines didn't prioritize that, and which, you know, I'm still trying to understand. But you hit the nail on the head, Senator.
Thank you.
Thank you. If I can just follow up with Mayor Victorino real quick.
Go ahead, Senator De La Cruz.
If we can just make the same request, that any request to safe travels program that the County of Maui have asked for, if you could give us a copy of those letters, please.
Yeah, we'll do, we have, when we originally started back in October, we had sent in exactly the same request as Kauai, but I'll get it to you. I want to close with one thing. All of what you've heard from all of us mayors really amounts to one thing. We need to get some sort of working together kind of a situation where, like HCOM, and I'm the president of HCOM, and we're starting to formulate our plan. We need the state to look at what we're asking for, and like, again, one size doesn't fit all. You know, we've sent hundreds of people back over the last 4 or 5 months that have come to this island without the proper quarantine and the proper paperwork, and homeless that try to come in, and all these different issues. And we have been turning them around and sending them back. In fact, there was a cult that started out in Kauai and then came to Maui. We ended up sending them back, and we paid for it. We paid for 11 of them to go back to the mainland, and we paid it out of county funds. You know, I wasn't really happy about that, but that's the way life became, because they were coming here, and I had them sent back when they reached Honolulu. They never reached Maui. I didn't want them to come to Maui. And so there's a lot of stories we could say that we could spend hours and hours and hours. You know, Maui has stood very quietly and doing the job that we need to do, and you know, our infection rate is high in the sense of community spread versus visitors, but we're working hard to make sure we take care of our problems before they get out of hand. We did it on the 9th, we did it on Molokai, and we're doing it here in Maui. And so I'll get whatever other information you need, just email Josiah, and we'll take care of it for you. I want to thank you, the senators, for doing what you're doing. I appreciate your manao, your feedback, and we stand ready to work with all of you. Mahalo and aloha.
Thank you. And if we can just ask all the mayors, and you can just respond to us in writing, it can even be an email, your experience in working with the Safe Travels in regards to the quarantine component. You know, the last time we met with Director Murdoch, his position was that the mayors and the counties would have to go onto the state's platform and search for all those who arrived versus them sending you a daily list, which I think makes it more difficult for your different police departments. So that component we haven't gone into as much, but we whatever feedback you can provide us so that we can follow up as to how we can make sure the information gathered through the Safe Travels can be better disseminated, better collected, so that you can actually help us implement some of the quarantine policies that the governor created through the emergency proclamation. And if any of you want to comment on that particular area, go ahead. Derek.
Oh, okay. Chair, thank you. Yeah, you know, when it comes to quarantine enforcement, in fact, enforcement of all of the governor's orders and the mayor's rules, it falls upon our police departments. National Guard has been a tremendous help, but they do not have the sort of authority to enforce the law, but they've been tremendous. And so whatever the state can do to make it much more operational for our local law enforcement, our police department, would be greatly appreciated, because you know, they've been full throttle from the very first governor's executive order. And I gotta thank our police department, Chief Raybuck and the whole team, because as a department, they had said that our #1 priority is the health and safety of Kauai. We're gonna throw everything at enforcing on these new rules and these new orders, because we have to send the message that this is not just lip service, and we have to get a level of compliance. And that's why you're seeing, I think, the good success rates on Kauai. And so if we can work out a system to make sure that whatever database is easily accessible to our local police department, we can really do a better job at effectively managing quarantine compliance and also enforcement of quarantine violations.
Okay, so thank you, and we appreciate that. So whatever feedback you guys have, and you guys can bullet them, outline them, provide them to the committee, and then we can follow up with the different departments. Mayor Roth, do you have any follow-up?
You know, I just want to thank the committee, and, you know, listening to my colleagues from the neighbor islands, I think, as Mayor Victorino and Mayor Kawakami said, you know, one size does not really fit all for all of us. And, you know, I think there's some great takeaways in listening to my colleagues, that one, yeah, we're all different islands. We're all dealing with different things, and we should have that ability to set the rules for each island. You know, for our island right now, it looks like we're going to have that secondary test continuing, but not everybody has that opportunity. So I just want to throw that out. If we
Okay.
get back to our own rules, I think that'd be a great thing.
And if you can also send the committee any requests that you make to the copies of any requests you made to the governor's office regarding the Safe Travels app.
Sure.
Thank you.
Will do.
Okay, any other questions for any of those? Any questions for Enterprise Technology Services or the Attorney General? Okay, if not, I want to thank all of you for participating. We really appreciate all your efforts, your time, and everything you're doing to help limit the spread of COVID. So mahalo. Okay, if no further business, adjourn.